The focus of this videotape is on asepsis and hand washing. Hi, I'm Kathy Getrust, and I'm an instructor in community health nursing. People once believed that sickness was caused by evil spirits or retaliation by the gods for misdeeds. About 150 years ago, a French chemist by the name of Louis Pasteur discovered that many diseases were caused by bacteria. He also discovered that bacteria could be killed by heating. Pasteur's name has been used to refer to the heat method of killing germs. You may be familiar with the word pasteurization. Pasteurization is the process of heating milk to kill harmful bacteria and make it safe for all of us to drink. Pasteur and other scientists developed what is called the germ theory. This theory states that all infectious diseases are caused by living things called microorganisms. These microorganisms are very small and unable to be seen with the naked eye, but nonetheless exist. There are a wide variety of microorganisms. Some examples are bacteria, viruses, fungi, and protozoa. Many microorganisms are useful to us. They are called non-pathogens because they do not produce disease. Some of the ways that they can help is that they can help in the process of making cheese or yogurt, in the baking of bread, or in the breakdown and digestion of food. There are other microorganisms, however, that are called pathogens. These pathogens are not useful to the body and can produce disease in humans. Infection occurs when these pathogens invade the body and cause disease. For disease to occur, certain conditions called the chain of infection must take place. The first in this chain is the causative agent. That means there has to be exposure to a pathogen that can actually cause a disease. An example might be a germ such as bacteria. Then there has to be a reservoir or a source. The human body is one of those sources or another place in which the pathogen can grow and reproduce. There also needs to be a portal of exit. That means there has to be a manner in which the pathogen can leave the body. Example might be through the nose by blowing or coughing or sneezing. Then there needs to be a mode of transmission or a method in which the pathogen is carried from one person to another. Typical examples would be on the hands, on the food we eat, or with sexual contact. Then there needs to be a portal of entry. A portal of entry means the manner in which the pathogen enters another person. Examples of that might be through the mouth, through the nose, or a break in the skin. You also then must have a susceptible host. By susceptible host, I mean someone that's more likely, at a higher risk, of becoming ill than someone else. A susceptible host might be someone that has poor nutritional habits, poor sleep habits, or has a chronic problem with stress that makes them more susceptible to the invasion of pathogens. It's important to note that a break in any one of these links in this chain of infection can prevent the spread of infection. An example might be a break in the mode of transmission. Without dirty hands filled with germs moving from one person to another, the pathogen is not going to be moved. So by the use of proper hand washing, that mode of transmission can prevent the spread of infection. The body has some natural defenses that protect it from an infection. Some of those defenses include the skin. This is probably the most important one, as it acts as a barrier against entry of pathogens. The skin must remain intact, however. That means that it cannot be impaired in any way for it to protect the internal organs from the outside environment. Another defense is the mucous membranes. Mucous membranes are the lining of the respiratory tract, the urinary tract, and other passages. These mucous membranes are sticky and they trap foreign material. Cilia is another defense that we have. Cilia are fine microscopic hairs that line the inside of the nose and other parts of the respiratory tract that propel the mucus out of the body and prevent us from becoming ill. Coughing and sneezing also helps remove foreign material from the lungs, throat, and nose. Hydrochloric acid is a very strong chemical that's produced by the stomach that destroys many pathogens as we eat them on our food and on the hands that we put next to our mouth. Our eyes are protected by tears that provide a flushing action to remove many of the pathogens that enter the eyes. A fever will increase the body temperature, making the environment for germs to survive unsuitable, and therefore pathogens will die. White blood cells are a certain type of blood cell that destroy and devour pathogens that make it into the bloodstream. Inflammation is another defense, in that it is a process that brings blood to the area of infection. Signs of inflammation are redness, swelling, heat, and pain. Maybe you've experienced the inflammation process when you have stubbed your toe or have an abscessed tooth. You notice there's redness, swelling, heat, and pain that accompany them. It's actually a defense that the body has to localize the infection and keep it from spreading to all other parts of the body. The last natural defense that we have is the body develops substances called antibodies after having an infectious disease. These antibodies are proteins that sometimes can protect the body and prevent the occurrence of that same disease occurring a second time. An example that comes to mind would be measles. Once a person has measles, antibodies are developed, and frequently it is not likely that that measles will happen a second time. Serious bacterial and viral infections are increasing in healthcare facilities as well as in the general public. Ill patients, especially the elderly and frail, are particularly susceptible to infectious diseases, as are the very young and those folks that have chronic illnesses such as diabetes. Bacteria are often the cause of serious illnesses. Unlike viral infections, bacterial infections are usually treated with antibacterial agent called an antibiotic. When antibiotics are prescribed, it's extremely important to take all of the medication prescribed for the entire length of time that it has been prescribed for. If the antibiotic is stopped too soon, some of the pathogens may remain and become resistant to that antibiotic. certain pathogens have become resistant to the antibiotics that are most commonly used against them, there are serious problems controlling infections in healthcare facilities. When these pathogens become resistant to an antibiotic, those that are still effective are often much more expensive than the others were, and also may have much more serious side effects compared to the previously prescribed antibiotic. It's possible also in time that the pathogens may develop a resistance to these newer, more expensive antibiotics. Two groups of pathogens have become resistant to two of the most powerful antibiotics that we have. These antibiotics are called methicillin and vancomycin. The organisms are called methicillin-resistant Staphylococcus aureus. That's a long name, more commonly referred to just as MRSA or as MRSA. This pathogen is found normally on the skin and the mucous membranes. The other type of organism is called vancomycin-resistant enterococci, another big term that is more often called just VRE. This pathogen is found in the stomach and intestinal tract, but both are major causes of hospital-acquired infection in healthcare facilities today. People who develop one of these pathogens have very limited, if any, antibiotics that are available in our arsenal to combat them. There are actions and procedures that can help prevent the transmission of infection to protect yourself, your coworkers, and the people within your care. Although it's not possible to eliminate all pathogens from our bodies and environment, there are measures that can be taken to help reduce them. Medical asepsis refers to medical practices that reduce the number of pathogens or interrupt the transmission from one person to another. Many actions and procedures can help prevent the spread of infection. Most will be discussed in another tape. Hand washing is the most important procedure we can do to prevent the spread of infection. Please watch now as a nurse consultant in infection control speaks about hand washing.
Hand washing, of course, is the most important task that any of us can perform in our duties of caring for residents. This hand washing prevents the spread of germs that can cause infection. And think of germs as those small little microorganisms that I talked about earlier. You must wash your hands for at least 15 seconds, and I recommend 30 seconds. You must cover all surfaces of your hands by washing, making sure you get in between the fingers. If you think that underneath your fingernails have become contaminated, you want to use a file or some sort of a tool to clean underneath your nails. But make sure when you're finished soaping up, you rinse well under clean, tepid water. You also want to make sure that you put your hands down so the germs in the water are going off of your fingers, not up your sleeve, because that can cause you to have potential infection if your hands have been badly contaminated. The type of towel that you would use to dry your hands, I recommend that you do not use cloth towels. If you do, use them one time and throw them into the laundry. You do not want to have 5, 10 different people. You probably don't have that many people working in your facility, but if you did, you don't want to have 5 or 10 different people handling that wet towel and drying their hands on it. The wet towel can promulgate germs, and also, you know, you don't know if your coworker has washed their hands properly and actually applied the germs onto the towel. What about wearing gloves and hand washing? There's a lot of confusion out there as to what to do when you're wearing gloves. Do you still need to wash your hands when you're finished with the gloves? Do you need to wash your hands before you put the gloves on? Well, we'll go over that now. Certain guidelines are set forth by the regulations and must be followed by all employees. You must wash your hands before applying gloves. That is mandated in the regulations. You must wash your hands when removing gloves, even if you feel your hands have not become contaminated. Gloves are not impervious, and what I mean by that is gloves have very minute, small holes in them. So if you are dealing with stool or urine or blood, you may in fact contaminate your hands even though you have gloves on. So don't feel so secure, well, I had gloves on so I don't have to bother washing my hands. That is not proper according to the regulations. It doesn't matter whether you wear latex or vinyl gloves, they still have that same potential to have the small holes in them where germs could sneak through and get on your skin. It is the responsibility of your employer to have a location for hand washing available at a reasonable distance from your normal work area. So that would make it easier for you to wash your hands conveniently in a routine basis. So you don't want to be working in one hallway and you have to go all the way down another hallway or around or upstairs, downstairs to wash your hands. So this is the responsibility of your employer. So if this is a problem, you might want to discuss that with them. When do you wash your hands? You always wash your hands before you start working, before taking care of a resident or a patient, before you eat, before handling clean linens. You want to get into clean beds, so you would expect your residents or your patients to get into a clean bed also. You always want to wash your hands after taking care of a resident, no matter what kind of chore or duty you have provided to that resident. The end of your workday before going home. You want to make sure that when you leave your workplace, you have decontaminated your hands and you're not taking germs into your automobile, or if you stop for an ice cream, or home to young children that you may be picking up at a babysitter. You don't want to contaminate your family. You wash your hands after feeding a resident. You may think, oh, I'm not having any problems. I didn't get any food on my hands. It's still potentially possible that resident could have passed on some germs to you through their food, through spitting or whatever, wiping their mouth with a napkin. So you want to make sure you wash your hands before you move on to another task. After eating yourself, you want to wash your hands, especially if you have a cold or a little flu or some kind of virus, but you've still gone to work. You want to protect yourself and your fellow employees and other residents of your facility from passing on those germs. After toileting, this is a mandatory thing. When you go to the toilet, you must wash your hands properly with soap and water. Just putting your hands under a little bit of water and rubbing them a little bit and then drying them on a towel is not cleansing your hands properly. You potentially could be passing on germs. Using any sort of equipment, you want to think that it's potentially possible that one of your fellow employees did not decontaminate a piece of equipment the way you might. So if you use a piece of equipment, you want to make sure that you wash your hands properly after using that, because you're not sure whether or not there were germs on that piece of equipment. You want to wash your hands after sneezing, coughing, or blowing your nose. It's improper for you to blow your nose and then instantly go back and feed a resident. Just think of the potential germs that you could be passing on by putting your hand up to their mouth or touching their food directly with your hands. And applying makeup. If you decide that you need to apply some makeup before coming back to work after your break or your lunch, you want to do that in the bathroom where you have the washing facilities, and then wash your hands before you start your work again. Immediately after touching blood, body fluids, secretions, excretions, and contaminated items, whether or not you have been wearing gloves, you want to make sure that you wash your hands. You might not think that you had any problems or got any germs on your hands, but just protect yourself and cover yourself. Do that extra step. And between resident contacts, this is sometimes difficult because you may not be right by hand washing facility to wash your hands, but before you go on to the next resident to do some care, you want to attempt to wash your hands as frequently as possible. Types of soap to use. There are many types of soap out there in the workplace that could possibly be in your facility. I recommend that you use a liquid soap. There's multiple kinds. There's antimicrobial, which is shown here, and there's also antibacterial, which is similar to like Dial liquid antibacterial soap out there in the stores. You do not want to use a bar soap, and I'll tell you why. The bar of soap can sit in the tray that it might be sitting in, be wet, be damp, and that does not dry out. It still stays so damp. That is a perfect area and a perfect spot for germs to grow. So if somebody did not wash their hands well and left germs on that bar of soap, and then turn around and you pick up that bar of soap, you are actually putting more germs on your hands than you had before you decided to wash your hands. So you want to make sure that your facility provides you with liquid soap, preferably antibacterial or antimicrobial. Types of towels to use. I did discuss that earlier, but I'm going to go over it again. You want to use a paper throwaway one-time use towel for drying your hands is the preferred way to dry. This way, any germs that you might have left on your hands are put on that towel and thrown in the garbage, not kept on a cloth towel.
There may be times that a sink with running water is not readily available for you to wash your hands. The health care facility where you work is required to provide you, in those instances, with a waterless disinfectant for your hands. There are different types of waterless hand disinfectants. I have two types here. One is a liquid and the other is a disinfectant towelette. There's also a foam type that you might see in your healthcare facility. These are not intended to replace hand washing with water. They're just intended to be used for an intermittent solution. When using any one of these products, it's important to rub vigorously with the disinfectant and make sure that all of the surfaces of your hand are covered. And make certain that you interlace your fingers so that all parts are covered. This should continue for approximately 15 seconds. As soon as possible, it's important that you do wash your hands with soap and water. In closing, please watch as proper hand washing with soap and water is demonstrated. Remove any jewelry. A simple band may be left on. Turn on the water with a dry paper towel. Adjust the water to a comfortably warm temperature. Wet your hands, keeping the fingers pointed down. Add liquid soap to make a lather. Rub the hands vigorously to create friction. Interlace the fingers. Wash for a minimum of 15 to 30 seconds. Rinse hands with fingers pointed down. Dry hands thoroughly. Dispose of the damp towel in a wastebasket. Turn off the faucet with a dry paper towel and dispose of the toweling in a wastebasket.